World Health Organization says the prevalence of obesity has more than doubled between 1980 and 2014. Currently, about 11% of men and 15% of women, equivalent to 500 million adults worldwide, have been classified as obese. But there could be a solution in government taxation.
Taxation of sugar-sweetened beverages can reduce their consumption and therefore benefit the risk of obesity and diabetes. We are seeing an incredible increase in the prevalence of obesity in the world, where above 600 million people in the world were affected, which also translate in a very large number of people with diabetes, over 400 million.
W.H.O maintains that taxing sugary drinks could lead to about a 20% increase in their retail price, resulting in a reduction in consumption. In Africa, where diabetes was once uncommon, it's now considered an epidemic. Millions of people have succumbed to the disease before being diagnosed or treated. Taxes and subsidies influence purchasing patterns, and it could be a way to curb the intake of sugar-sweetened drinks.
W.H.O recommends not to exceed 10% of energy coming from free sugars, which for an average adult that corresponds to approximately 50 grams or the equivalent of 12 teaspoons per day. For a child, depending on the age and the size, that of course would be much less. But if we take the 5% recommendation, then an average adult should not exceed the 25 grams or 6 teaspoons per day.
The rate of diabetes has risen the most in the Eastern Mediterranean, followed by Africa, the Middle East and Asia. Catherine Omwando, CCTV.